I would like to welcome Miss Mamta Carroll, who is the Senior Vice President and Regional Director of Smile Train India. Over to you, ma'am.
Thank you and good evening, everyone. Welcome to this webinar with Foxy for Maha Smiles. As some of you may know, Smile Train is the world's largest cleft-focused organization with a sustainable and local model of supporting cleft treatment and comprehensive care. And for over 20 years, we have supported safe and quality care for more than 1.5 million children worldwide and 7 lakh surgeries in India alone. India being the largest program of Smile Train in the world. And we work with 150 partner hospitals across the country. We aim to expand our footprint further into the most remotest part of the country to make quality cleft care accessible to everyone in need. And now I'll tell you something about the Maha Smiles project. So can you show the Maha Smiles slides, please? Thank you. So coming back to India, we are extremely grateful to our partner, our corporate partner, the Bajaj Finserv Group, for their generosity in supporting the Maha Smiles project. The Maha Smiles project actually is a flagship CSR collaboration between Bajaj Finserv and Smile Train India to build awareness and support treatment for children born with clefts. And since the time we collaborated in the year 2023, starting in August when we launched the Maha Smiles project, nearly 8,000 life-transforming cleft surgeries have been supported under this project. This is basically to create not just awareness, but also build a referral network so that children can avail this treatment from birth itself, and the treatment is, of course, absolutely free of cost. This is done via our centers in Maharashtra, which spread across 10 cities in Maharashtra. We have 11 treatment centers which are approved by Smile Train, and everything at these treatment centers is absolutely totally free. And to support this project, I urge everyone who is on this call and beyond that please call our toll-free helpline 1-800-103-8301 so that children and people and families can be helped. As most of you may know, that all parents want their children to develop a positive self-image, make friends, do well in school, and mature into well-adjusted, productive adults. Parents of children with clefts share the same hope and dreams, but often wonder whether their child's cleft will deter him or her from reaching these goals. During this period, it is absolutely essential that they receive support from their families and friends to ensure that their self-esteem and self-confidence are intact and are developing appropriately. And this is the focus of today's webinar, as we look forward to Dr. Martin Person's talk today about psychosocial counseling in cleft care. I now hand over to Dr. Sujit Konkar, who's the chairperson of the Web and Media Committee, AMOGS, and he is also the moderator of today's webinar. So welcome, Dr. Konkar. Over to you.
Thank you, Mamta ma'am. Good evening, respected seniors, friends, and colleagues. We are going to present 7th ECME of cleft lip and cleft palate. This series has been started by AMOGS in collaboration with Smile Train India to increase the awareness about cleft lip and cleft palate. We are very much thankful to our past president, Dr. Pardeshi sir, President Dr. Kiran Kurtukoti sir, Secretary Dr. Bipin Pandit sir, and all office bearers for constant support to this activity. Special thanks to Dr. Rashmi Kahar, who is convener of this webinar, who is having very great efforts to make this series successful. Today we have two eminent speakers, Dr. Jaya Turaskar, who is going to talk on Introduction to Cleft Lip and Cleft Palate, and Professor Martin, who will guide us about the psychological counseling in cleft patients. Welcome, I welcome and invite to both of you. We are eager to listen to you. So without much delay, I request Dr. Rashmi for further proceedings.
It's a great honor today to have this collaboration and 7th webinar of Maha Smiles with Amox. It's a great and proud privilege to welcome our respected President, Dr. Kiran Kurtakoti sir, to the platform. Sir is President of Amox and has been on chairperson of various committees like MTP Committee, Foxy in 2009 to 11.
Rashmi, it's okay. It's fine.
Okay,
Fine.
sir. So we would like to hear from you.
Thank you. Thank you on behalf of Amox and welcome on behalf of Amox to everyone. Indeed, it's a very nice collaboration. And I would like to especially also mention Science Integra because they've been instrumental in making this thing work. And I would welcome on board Dr. Martin and of course Dr. Jaya, who will be giving their presentations today. And we really look forward for this collaboration and presentations in the times to come. Thank you.
Can see what there is 25 numbers per night. The island what you get a boutique hotel there. 25 per night. I handle it. I think Devma, picture Devma, Malpoti, Devma.
I would request Dr. Bikin to give his comments.
Hello. Good evening, everybody. It's nice to be here and thank you very much for inviting me for this excellent collaboration with the Smile Foundation. And you all are doing a great job helping these children with cleft palate and cleft lip. And most important is the diagnosis, which has to be done antenatally so that they receive the treatment promptly as soon as possible. And of course, more than the physical cope up with this sort of deformity, which can be totally correctable. So thank you very much again for Science Integra and Amox for inviting me to be part of this excellent seminar. Thank you very much.
Thank you, respected Dr. Bipin Pandit, sir. It's a great honor to have you today on this platform. We would like to inform as convener or moderator of the series that we will be doing 6 zonal webinars and we'll be trying to reach each zone of Amox in next subsequent months. So we will be involving our zonal coordinators and state and national coordinators for the subsequent webinar so that we can reach we will try to reach each and every society of Maharashtra OBGY societies. So I take your permission to proceed towards the scientific program. And I would like to introduce our speaker, today's speaker, Dr. Jaya Kori Tulaskar, to the house. Dr. Jaya Kori Tulaskar is a budding new generation gynecologist. She's a youth coordinator of Team Amox 2024 and 26. With recipient of late Dr. R. Anjana Jailu Memorial Gold Medal for standing first in PG exams and also a recipient of MGI MS Gold Medal. We welcome you, Dr. Jaya. And we are very eager to listen to your talk.
Thank you so much, ma'am, for your kind introduction. Good evening to respected seniors. Just start my presentation. Is it visible?
Not yet. Yes, now it's visible and we will have to make it full screen. Yes.
Yes, ma'am.
It's perfect now.
So my topic of today's presentation is introduction of the cleft lip and palate. So it is the most common congenital facial malformation. It can be isolated or presents in combination, that is cleft lip and palate. Treatment at right age and right time is required. Often the management is multidisciplinary, interdisciplinary, and coordinated. So cleft lip is the failure of fusion of the frontonasal and maxillary processes. It results in cleft lip either through lip, alveolar, or nasal floor. Cleft palate is the failure of fusion of palatal shelves of maxillary processes, results in cleft in hard or soft palate. Why clefts are predominant in the facial region? Because It is one of the most complicated processes in the human body, that is craniofacial development, where the multiple processes has to fuse and requires a great inherent developmental force. And heart develops and start to pump blood before the development of facial structures. Before moving on to the etiology of the cleft palate, one should know the embryology, so I would like to discuss. So at cranial region, the cranial neural crest cells are present at the back of the embryo, which then traverses towards the front, from back to the front. They multiply there. Once they come to their target destination in the facial region, there they mature and develop. Eventually, they contribute to the facial bone, cartilage, and nerves. Their multiplication, division, and differentiation is critically important for the facial development. At around 4 weeks, these CNCC cells then externally take shapes, and there is development of the 5 swellings, that is frontonasal prominence and 2 paired mandibular and maxillary prominences. At around 5 to 6 weeks of gestation, these frontonasal prominences then have nasal placodes, which then invaginates to form the optic nasal pit, and there is also development of the optic pit at the same time. At around 7 weeks, these prominences then the mandibular processes fuse to form the lower mandibular part and lower lip. This frontonasal prominences then develops into the lateral nasal process and the medial nasal processes. This medial nasal processes fuse to form the medium septum of the nose, philtrum, 4 incisor teeth, and primary palate. And the lateral nasal septum then forms the lateral part of the nostrils. So the part of the upper lip is formed from the frontonasal prominence, that is philtrum, and medial part of the upper lip, and the maxillary processes. So any disturbance in the development of this or fusion of these processes, whether it is genetic or any environmental or any embryological, anything which happens, then it leads to the development of the cleft lip. Embryology of palate. At the same time, after 8 weeks, there is development of the palate begins, which is completed around 12 weeks. The median nasal prominences fuse in the midline to form the primary palate. This medial side of the maxillary processes rotate and develop into lateral palatine processes. They fuse in the midline to form the secondary palate. So failure of this midline fusion may lead to the formation of the cleft palate. Etiology is often multifactorial. There may be genetic predisposition, nutritional disturbances, any traumatic stress, defective vascular supply to the affected area, mechanical disturbances. There are many drugs like aminotriptyline, cortisone, or thalidomide, anti-cancer drugs. Effect of alcohol, smoking, radiation, infection has also been encountered in the etiology of the cleft lip and palate. Few syndromes which are associated with the cleft lip: autosomal dominant like Van der Waals syndrome, autosomal recessive, Meckel syndrome, Robert syndrome, X-linked orofacial digital syndrome type 1, isolated cleft lip with ankyloglossia, and few trisomies 13-18. Non-Mendelian Pierre-Robin syndrome is also found to be associated with cleft lip and palate. What are the factors which influence the incidence? It is more common in males as compared to females. American Indian and Afghans show higher rate of incidence. Babies with isolated cleft palate have lower birth weight as compared to the isolated cleft lip and palate. There is increased incidence has been associated with the increased parental age. Incidence is more in the firstborn child, and malnutrition increases the chances of cleft lip and cleft palate. There's another separate entity, that is isolated cleft of palate. It appears under strong genetic influence, more common in females. Severity may range, as we can see in this picture, may range from the mild notching of the tip of the uvula to the cleft extending to the soft palate alone, or into the hard palate, or up to the incisive foramen. It is usually associated with the Pierre-Robinson syndrome. Types of cleft lip and palate may be unilateral cleft lip, maybe bilateral cleft lip, cleft uvula, unilateral cleft palate, bilateral cleft palate, unilateral cleft lip and anterior palate, depending upon the where there is non-fusion is there. Unilateral cleft lip and full palate, bilateral cleft lip and anterior palate, or there may be bilateral cleft lip and full palate. For the diagnosis of the isolated cleft palate, the equal sign, which is a novel marker in the diagnosis of fetal isolated cleft palate, unremarkable uvula, it implies that the palate is intact, because if the uvula is absent, that means the sign will not be seen, because if the uvula is present or it is normal, then we can see that equal like sign in the USG that denotes the uvula palate is normal. If this sign is not found, that means either uvula is absent or it is deformed. Then we have to further evaluate the palate for its morphology. Clinical features in the cleft lip and cleft palate are more pronounced if the cleft lip is associated with the cleft palate. So feeding problems may be there in the neonate, that is there may be regurgitation or choking or the inefficient suction from the nipple. Then excessive air intake may be there. Because of the nutritional issues, baby will have failure to thrive, speech problems, hearing problems, recurrent ear infections, glue ear. And there may be dental problems like mobile premaxilla, poor oral hygiene, impacted teeth, and the very important, that is psychological problems. Often patient feels, why me? Why I look different than the other children? So obviously the child will have decreased self-esteem, difficulties in the social interactions. The management requires multidisciplinary team approach, orthodontist, cleft surgeon, clinical psychologist, ear ENT surgeon, clinical geneticist, all pediatrician, all has to be work coordinately. The baby is born, often the initial management, there is a special nipple and bottle feeder with one wave wall, especially for the cleft palate. Use of feeding obturator and special feeder is needed. So the management requires education, then counseling, treatment at right age and right time, and psychosocial rehabilitation is very important in the management of cleft lip and cleft palate. This is all about introduction of cleft lip and cleft palate. Thank you.
So that has been very nice and excellent talk by Dr. Jaya regarding the introduction of cleft lip and cleft palate. Your diagrams and your animation was great to understand the basics. Anything you want to add, Dr. Rashmi?
Sorry for the little technical glitches. Jaya, it was amazing, excellent, and very well prepared talk, especially how you beautifully told us about the development of cleft lip and palate, and also the importance of the equal sign. Dr. Sujit can throw more light on it. So, in all, it was a wonderful talk.
Thank you so much, Rashmi ma'am, Sujit sir, for the opportunity.
So we have done up to 7 webinars of Smile Train, and in each webinar, we have been continuously talking about the importance of psychosocial support to the patients of cleft lip and palate. And we understand the importance of psychological support in these patients. And we were continuously finding someone, we were looking forward to someone who could really make us understand how to help this patient. And today we have Dr. Martin Persson. He's the Professor of Health Sciences at Kristianstad University, Sweden, with considerable experience coordinating and managing over 50 international projects. And he will be talking on psychosocial aspects of cleft lip and palate. Sir has been phenomenal in funding many psychosocial health activities, educational activities. He has research ventures which are diverse, and they cover everything from in-depth qualitative analysis to broad-scale epidemiological studies. He harbors a keen research interest in profound effects of visible differences and negative body perceptions on individual psychosocial well-being, broader public health concerns, including those facing social disadvantages. So, and he is applying his specialized skills in developing methodologically sound and educationally enriching courses and training programs. And we are really looking forward to listen to you, sir. We welcome you, Dr. Martin, sir, and would like to listen from you. Thank you so much.
Thank you so much for that kind introduction. And I will see if I can share my screen so you can see my presentation. So I think you all can see the big slide. Yes, excellent. So I will talk today about the journey together. So understanding cleft lip and palate in the childhood development and family care. So I will actually be focusing more on the parents in my lecture today and some of the adverse effects of being born with a cleft lip and palate. But I'm going to start a little bit about background. So as we all know, that the early childhood, defined as the period between prenatal development to 8 years of age, is increasingly recognized as the most crucial period of lifespan development. And it is here that the foundations are laid for every individual's physical and mental capacity, hence influence their subsequent growth, health, and development throughout the life course. Early childhood is also considered the period of the life course which is the most highly sensitive to external influences. And we know from a big study, social inequalities in early childhood and health and development. This was a European-wide systematic review, but it's applicable to all of the world. And there is strong evidence that lower parental income and wealth, or lower parental educational attainment, lower the occupational social class, parental unemployment, or neighborhood deprivation, but they are all independently associated with a wide range of adverse health and developmental outcomes in early childhood. So if we now know this background, we have to put that in context of cleft lip and palate, because we know, as our former speaker said, this has an additional burden on the family and the individual itself. But as I said, I will focusing today mostly on the parents' perspective. And we know from research that parents might find the following stressful: the impact of a diagnosis, which I will talk about, reaction of others to the child's appearance, the parent's psychosocial well-being, fears about the long-term future for the child, various treatment decisions making, the burden of care, for example, hospital appointment, surgery, or access to care. And also, in addition, the child's condition may be part of a syndrome, as we were informed about earlier, that is associated with delays in development of speech, motor coordination, and/or social development. I will focus on the top 4 highlighted in blue today. So when we talk about the diagnosis, we often talk about the initial reactions of the parents. And there have been quite a lot of research conducted on this. For example, a British study found that a significant number of participants felt that non-specialist healthcare professionals lacked the sensitivity, knowledge, and empathy when we were diagnosed antenatally. And additionally, 39% of the participants were unhappy with their overall experience of receiving the diagnosis, how they were informed that their child will be born with a cleft lip and palate. Not just research from South Africa and Brazil, where said mothers experienced a range of emotions, including surprise, tears, shock, despair, denial, fear, and various other feelings. But the arrival of a child with cleft lip and/or palate triggered a complex blend of emotions in parents, again, including shock, anxiety, distress, worry, sadness, misery, primarily because they were unaware their newborn would have a cleft lip and palate. So we know now that even if you have a scan and find out that before the delivery, it creates worriness in the parents. And for those parents that are giving birth without knowing it, it's even more of a shock and everything. And this diagnosis information, why many people were dissatisfied with this, is how we receive the information. And this is a common theme in several studies, and I highlighted some of the newer ones here for you. And it was mainly about how the information is received from a healthcare professional. And those that got the diagnosis from scanning, they also said it was unclear language, unclear information. We couldn't make sense of the information and so on. And this goes and leads then to actually that parents that felt the information from a diagnosis was favorable was when they viewed that the healthcare providers were skilled and reliable, and when the communication with them was clear and effective. So basically, how the healthcare professional gave the advice, how assured and relaxed they felt, increased the well-being of the parents. So here we're talking about mastering very good communication skills. And also another study showed that many parents would like to have more opportunities to talk with the healthcare professionals. So even though we get the diagnosis, even though we get good information, good communication, we still would like the ability to come back. Because this is a time where parents process. There's so many questions, and many felt if they could reach back out and have a conversation, that would ease their worries. But we also mentioned reactions. And a lot of studies also showed that there are negative reactions from friends, family members, even healthcare professionals, and members of the public. For example, some studies, 50% of the parents reported that they avoid family gatherings because of a child's condition. And parents may feel uneasy and reluctant to take their children out in the public due to receiving unwelcome stares, harmful remark, and or being the subject of gossip. So they feel quite vulnerable taking out, especially before the initial operation, but even research shows even afterwards. And it's this constant that they didn't give birth to the perfect child, as Mani said. They have to almost deal with a loss in a way that their child were different. Doesn't say we love it less or anything, but is that guilt about something happened. And then when we end up this event about diagnosis, reaction from others, worryiness about the children's future, we come to the parents' psychosocial aspect. And we know that psychological stress in parents of children with CLP is a common phenomenon. And again, if you look at the latest research here, this has been verified over and over again. And a lot of it is guilt. They felt they have done something wrong. And this can be influenced by different various cultural influences as well. How this is difference between India and Sweden, for example, or South Africa, and so on. So being a healthcare professional, as we all are, we need to learn how to mitigate this and understand the stress of the parents. And parents should receive assistance from specialized healthcare professionals. And with specialized healthcare professionals, I mean, you don't need to be a clinical psychologist. What we do a lot, we train healthcare professionals as yourself how to communicate and how to address the psychosocial aspects so you can help the parents or even the child or as they grow up. And these trained healthcare professionals offer guidance on psychological issues and collaborates with them to reduce their daily challenges. And we know, for example, from a Polish studies, where you looked at intervention, how you increased the family resilience to handle the stress. that works great. And these are quite cost-effective ways to do it. And as I will talk a little bit later in my lecture, is about the family-centered care. But we're also going to address another aspect about parents often worries about their child's future. And I'm going to discuss two aspects from studies we have done across the world about education and mental health in relation to individuals with cleft. If we start with education, we ask us these two questions. Is there a difference between the general population and the population with cleft in relation to educational outcomes? And if so, is any particular group of a population with cleft more affected? So I'm going to go over some big population-based studies. And this study is an early academic achievement in children with isolated cleft, a population-based study in England. They had over 2,800 children without additional anomalies, 5-year-olds, between 2006 and 2012 were included. And they compared with a national average 5-year-old children. And so 5-year-old children with an isolated oral cleft, especially those involving the palate, have a significant poor academic achievement across all areas of learning. And we also saw in relation to special education needs that almost 30% of children were documented as having special education needs, which varied, and national rate was 9.7%. And this varied according to cleft type, from 13% with cleft lip to 47% with bilateral cleft lip and palate. Even though this is at young age, the age of 5, we go further and look at the Swedish study, which I did some time ago. We looked at the percentage not receiving their leaving certificate from compulsory school. In other words, they failed high school in Sweden, and this is at the age of 16. At that time of age of 16, we did the study, about 2.7% in the general population failed. When we looked at cleft lip, it's the same. There's no difference, 2.5%. When we looked at cleft lip and palate, over 7% failed compulsory school. And we looked at cleft palate only, it was 9.89%. So almost 1 out of 10 failed compulsory school in Sweden. So now, and this is the age of 16. And from this, there have been numerous studies that shows that individuals with cleft lip, especially palate only, has poor educational outcomes. They have learning difficulties, and they have higher use of special education services. So, unfortunately, we can say that being born with a cleft do have an influence on the child's or the individual's academic achievement. If we also look at mental health and neurodevelopmental, so in mental health, it's very important to know that around 20% of the world's children and adolescents have a mental health conditions. So when we compare to the norm, we have to realize that 1 out of 5 already has a mental health condition in the general population. And if there's a difference between individuals with cleft lip and palate, that means it's more than 1 out of 5. So the question is then, is there a difference between a general population and a population with cleft? And again, is any particular group of a population with cleft more affected? And again, I'm looking at the epidemiological studies because they have big numbers in them. For example, this Danish study, they compared over 8,500 individuals with cleft lip and palate with a matched control group of 85,000. And when you look here at the oral cleft, so all 3 combined, they are higher risk for any psychiatric disorder, especially when you divide them out in cleft lip and palate, and cleft palate. It's a higher risk for cleft lip and palate and cleft palate. And when you look, all of these that are highlighted in yellow shows a significant higher risk than the general population. And we go on to a Swedish study that looked at the increased risk for neurodevelopmental disorders in children with orofacial cleft. They had 7,800 individuals with cleft compared to a matched cohort of 78,000. But what is really brilliant in this study, they also included unaffected siblings, which total 9,600. And when you looked at the oral facial cleft, all three types together, you can see that have a significant higher risk for any psychiatric disorder, females and males, combined, males and females, intellectual disability, language disorder, ASD, like autism spectrum disorder, ADHD, and other behavioral disorder. And we looked at cleft palate only, you can see they have even higher risk for all of these conditions I mentioned previously. But what you also can see here is those in green are the siblings. They were not at risk for any psychiatric disorder or intellectual disability or ASD. So what this study concluded is that children with non-syndromic clefts have a significant higher risk of neurodevelopmental disorders. And the risk is unlikely to be explained by familial influences such as inherited genetic or shared environmental factors. So this is the argument from a previous presenter about the brain development of cleft lip and palate. Some scientists believe there's something going on in that development. For example, when a palate failed to fuse, is something also influencing the development of a brain. And this study kind of supports this in a way. We don't know because we don't understand yet these differences. But we also know when we look at the risk for prescribed psychotropic medication that it is higher for individuals with cleft. Here, we looked at the Danish study that compared over 8,000 individuals to 82,000, and the Swedish study that also had high. You might be wondering why I'm referring to so many Nordic studies. The reason is that we can follow our population and we can do linkage, so we can use big numbers. And that's why we're looking at this. And again, this shows that individuals with cleft have a higher risk to be prescribed a psychotropic medication, like for depression or anxiety. And in these countries, you need to have a diagnosis before you can be prescribed this medication. We also know from a research, there's an increased risk for psychiatric and neurodevelopmental disorders, as well as behavioral problems. So unfortunately, when we're dealing with our individuals or our population with cleft lip and palate, they are also a higher risk for neurodevelopmental disorder and psychiatric disorders. But it's important also to look at them that mental health issues should be viewed as a continuum. It's not black and white. So it is on this scale here. You can have a mental health issue, but it can still function positively, be here. And some of them severely impact. So we cannot say black and white. We have to look at the individual, the families all the time. And this comes to the outcomes. What do we tell the parents and how we work? Because outcomes are often mitigated by expectations versus reality. And it's our job as healthcare professionals to make sure that the parents, the family understand the reality. We manage their expectations. And even when it comes to the patients with cleft lip, these are some quotes from some of the studies we have done. My parents and the doctor always talked about what my surgery would do. They didn't warn me about how I would feel or how I could face people at school. Or if I had known what was to come, I would probably not have bothered with the surgery at all. I felt misled. I had a jaw destruction when what I really longed for was to get rid of my lip scar. I would like to have more time in different, less clinical environment to ask questions. So this all from patients in the teens asking these questions, what we need. At the same time, we talk about the role of a family. The family, particular parents, are very influential in the child's experience of a cleft in relation to the child's attitudes, beliefs, and values, through their own comments and behavior towards the child, through modeling their own attitude, values, and beliefs, and how active they are in their child's education. So this relates back to my introductory slides, the environment the child is growing up in. And when we talk about the patient, the family, and healthcare professionals, because that is the dynamic we operate in, while most caregivers preferred a shared approach to decision-making, children desire greater autonomy, particularly with increasing age. And the study showed here, since there was a limited agreement between caregivers and children, healthcare professional, us, must be aware of the differing preferences when discussing treatment plans to optimize both the patient and the parent satisfaction. So this leads us then to family-centered care. And that is an approach that, if you use it, it leads to better health outcomes, improved patient and family satisfaction. It becomes a more effective use of healthcare resources. Because if we can empower both the patient and the parents, that they feel comfortable, they understand what's going through, their expectations are realistic. They feel they have a good communication set with the healthcare provider, us. The treatment becomes more efficient. They adhere more to the treatment plans, and they feel empowered. So in pediatrics, family-centered care is particularly important as it recognizes that the family is the child's primary source of strength and support. And therefore, we need to talk to the family to figure out what kind of life situation are we coming from? What are their work? What do the parents do? How many siblings do we have? And all of those. And we know that this approach can also help to address the emotional, social, and developmental needs of children and their families. By doing that, we also ensure that the child and the family can thrive and develop in a positive direction, even though we're dealing with the conditions such as cleft lip and palate. As I said earlier, we have worked a lot in international project where we develop training for healthcare professionals. And if anyone are interested to find out more, you can just write me an email. And I would like to say in Swedish, tack så mycket. Thank you so much for listening. And I'm very open for any questions that you might have. Thank you so much again for giving me the privilege to present.
Thank you, Professor Martin. That has been very excellent and elaborative, very informative talk about the psychosocial aspects, psychological aspects of patients of cleft lip and cleft palate. Actually, all other practitioners or medical practitioners know only about the superficial level of these conditions. But you have shown every details and in deep the depth of the condition, which is it should be taken very seriously in our practice.
Thank you.
Thank you, Dr. Martin, sir. Your talk was actually the need of the hour. and it will be very helpful to all of us because today we have 408 people logged into webinar.
Okay.
So we are hopeful it will prove very helpful to all of us. Thank you so much.
You're welcome. It's my pleasure again. And if you need any more information or further, because as you know, this just scratched the surface of the psychosocial aspects in treatment. So please let me know. I'm happy to help.
So generally, sir, in our scenario, in our area, we see that cleft lip and palate, they come with various social taboos and misconceptions, and yes, there is some amount of blame game in the family. So this psychosocial aspect and support is a great thing in management of cleft lip and cleft palate patients.
Yes, I think so. And I know Smile Train thinks so as well. And as you as healthcare professionals, just listening to this means you are interested in this and consider it a very important factor in how we do provide care. It's not just all about the technical. A lot about it is about the communication, the engagement, how we use the family-centered approach.
So as a working obstetrician and gynecologist, it's really very difficult for us to hand over the undiagnosed baby born with cleft lip or palate to the mother. So thank you very much for your talk. It was very enriching.
Thank you so much.
I would like to request Dr. Sujit Konkar to propose a vote of thanks.
Thank you. It gives me immense pleasure to deliver a vote of thanks on this occasion. I am very much thankful to our esteemed speakers today, Dr. Jaya and Professor Martin sir, who have enlightened us with their knowledge. Special thanks to convener Dr. Rashmi Kahar, who has been working very hard to make this series very successful. Big thanks to Smile Train India for this noble initiative. We are working with all of you. Thanks, Science Integra, for giving a platform from day one. No programming successful without the audience. So big thanks to all delegates who have joined us for today's webinar. Thank you.
And special note of thanks for Mamta Madam. She is always encouraging, and Bajaj FinServ and Smile Foundations. And many thanks to our President, Dr. Kurtakoti sir, and Secretary, Dr. Bipin Pandit sir, and immediate past President, Dr. Pardeshi sir. They have started this wonderful series, and we are trying to reach to each and every obstetrics and gynec society of state of Maharashtra. Thank you very much. And special thanks to Dr. Sujit Konkar for moderating this session very well. Thank you very much. So have a very nice time, and goodbye from society.
Yeah, bye-bye.
Thank you, ma'am. Thank you, sir.
Suchira, you would like to say something? You are taking great efforts, and I must say, wonderful efforts.
Yes, ma'am. Thank you. Thank you so much for this. And I'm also having a great time learning new things about cleft care or anything else related. So today was a new topic related to psychosocial activities and everything. So I'm also grateful for you all to share your knowledge with us. I'm learning a lot from this.
Thank you. We are glad that you are a part of it. And Mamta Madam, I would like to tell you, she is very persistent and she pursues the webinars like anything. So every alternate day she will call and make sure that everybody is on time. Everything is set prior. So, wonderful efforts.
Thank you, ma'am. Thank you, Dr. Martin, as well, for your wonderful talk.
Thank you so much.
Thank you, everybody. Thank you, Dr. Rashmi, Dr. Sujit, Dr. Martin, and Suchira, and everybody, the audience, for listening to us and joining hands in making cleft care accessible and possible for everybody, making India actually cleft free. So thank you very much.